Hello. There is this conversation going on TikTok about the most toxic relationship in the healthcare is between aide and nurses. I actually didn't want to talk about this because it makes me so angry. Some of these behaviors around the healthcare. I did my LPN clinicals in a doctor's office where it was abortion clinic, and then a nursing home, and then I did my RN clinicals at the hospital. So the only time I worked in the hospital was when I was doing my clinicals. So I cannot really tell what goes on in the hospital, but I can talk about the nursing homes because I worked in the nursing home for years. Okay. The very rude, disrespectful aides are the ones who become the rude, disrespectful nurses. I'm telling you this for a fact. For over 20 some years working in the healthcare, that is what I have noticed. And it's not all. So don't let us generalize it like the toxic relationship in the healthcare nurses aides relationship. It's individual behaviors. That's why I said the very rude aides and disrespectful aides are the very ones who become rude and disrespectful nurses. I worked in the nursing home. You'll be working, okay? You have G2 patients. You have trach patients. Sometimes these G2 patients, you go in there to maybe give medication or something through the tube. It can be clogged. In the way of declogging it, you make a mess or something. And when you ask for help from the aides, they will look at you and tell you that you made the mess, so go clean it up. Aides. There are so many aides in the healthcare do not want to do anything. And I'm telling you, these are the aides who go back to school to become the very nurses who don't want to do anything. That is why I'm saying it's an individual affairs. I happen to be a director of nurses. I was a DON before DON, director of nurses in a facility. I don't write people down. I don't write people up. I sit you down and talk to you. Some of these aides, when you try to talk to them, they feel like they know it too much. Especially if you're a new nurse on a unit where there's a person who has become an aide for how many years. And they are the gurus, they are the doctors, they are the nurses on that unit. So you can't tell them anything. You know, I'm getting emotional because I have seen it all. And if I say I'm going to talk, somebody will think, oh, because you are a nurse, that's why you are talking like that. But there are good aides and there are badass aides. There are bad aides who don't want to do anything and they want to rub shoulders with nurses. You can't tell them anything. You can't direct them. Nurses are supposed to redirect and teach, right? The same way nurses get directions and teachings from the upper administration. The same way nurses are supposed to direct and teach aides. Some of these aides, as I said, sometimes you meet an aide who has been in that facility for so long, maybe working for 10, 15 years at the same place. They think they are the doctors, they are the nurses, they are everything. They want to teach you, the nurse, what to do and what not to do. You can't direct them. So let me tell you about my experience in the nursing homes, okay? So when I started my nursing career in the nursing home, as I said, you will go and you want to try to declog a G-tube or something, there will be a mess. Or a patient can cough and the G-tube can dislodge. We are supposed to, aides are supposed to turn and reposition patients every 2 hours. So if a patient coughs and maybe the G-tube dislodged, if you had gone in there to turn or position the patient, you will see that it has dislodged, so there will be only a little mess to clean. They won't do that. they will go and maybe the feed is all over the place. Then the nurse is in trouble. I'm telling you, the aides that are rude and disrespectful are the ones who go to school and become the rude nurses. There are aides that are willing to learn, are willing to go ahead and learn a lot of stuff. But some, you can't. You will be working with an aide. She will leave the unit because nurses, we are always there. You know, sometimes it's hard to take a break. They don't do their work. If I go to administer medication through oral medication, the patient opens her mouth or his mouth and you'll be like, damn, you will have to clean. Because me, I can't give medication when there's mucus and all that in the patient. I have to do it because you cannot go call the aide to come and do it. Why are you calling me to come and do it? You can also do it. That attitude. So you'll be passing medication, doing oral care. When are you going to finish? And then you get in trouble because your med administration is late. And then you'll be getting calls from upper. These are some of the things I quit the nursing home. Because you will meet a patient, the hair, bad, the mouth, the face. I can't stand it. I have to clean it. I have to clean the patient before I administer the medication or do a wound dressing or do G-tube or whatever I have to do as medical, as skilled nursing, whatever I have to do, I have to clean the patient. And you cannot call aide to come and do it. Aide will leave the unit and you don't know where they are when you question them. I had to quit one group home because these people will leave the house and you are alone in there. I questioned one lady, oh, my sister, and she's an African. My sister, you left leaving me here. If somebody comes in here and asks your whereabouts, I'll be a bad nurse because I don't know where the aide is. She was so upset. Just these words I said, tell me you are leaving so I know where your whereabouts. If anybody comes in and question where you are, I'll be responsible to say, oh, I know she's on break or something. But if somebody walks in administration, somebody walks in and they ask where the aides are and you don't know, you become a bad supervisor. So some of these things are behaviors individually. It's not the choice of a nurse to disrespect. I have worked with good aides, great aides who are willing to help, you know. But some of these people, you can't teach them. So it is individuals. It's individual. If I say this TikTok thing is not allowing me to express myself very well, but I will have to come back again. But the relationship between nurse and aide can be mutual depending on the individual because they are so rude, they are so disrespectful. I had to quit my nursing job. You can't tell any. And when it comes to you being, as I mentioned earlier, being a director of nurses in a facility, they see me as an African. How dare you come from Africa to come and be my director, teach me what to do, try to direct me. So there is always friction. So it's an attitude on individuals. It's not a whole thing. It's not a holistic thing that everybody else have attitude. All nurses have attitude or all aides have attitude. It's individuals. But if I'm going to talk, I say the aides that are so rude, they end up becoming nurses and they are worse. Those are the people. But if you go through nursing school, you go through the higher hierarchy, you don't even have the time to be rocking shoulders with aides. You can't tell them anything. You can't teach them. You can't direct them. Yes, I know there are some nurses that's what I said. The very aides that become nurses, they are the rude ones who become so rude to the aides that they left. From the nursing home experience, I don't even want to go there. So I quit nursing homes. I don't work nursing home. Even the home care, the group homes, I quit. I recently quit one because I can't be on a unit where I can direct people, you know, as a nurse. The aides are supposed to clean the bathroom. They are so filthy. They don't clean the bathroom. And especially those who wash whatever, they make the bathroom so messy. You can't tell them to go and clean. They will tell you, the nurse, to go and clean. So whose job is it?